So here's a pictorial of a typical patient flow. It starts with symptom onset to diagnosis, to discussion with physicians, to treatment selection, to support, patient support, and then eventual treatment fulfillment. Let's analyze this slide in a little bit more detail. So these are the two most important parts of any disease, from the time of symptom onset to the time of getting accurately diagnosed. Ideally, we'd like to catch the disease before symptom onset. But symptom onset can be hampered by patient and caretaker unawareness. They may just not know the disease. They can be masked by other symptoms. For instance, if you have heart disease or diabetes, those are sort of overriding indications, or even physicians who are not aware of a certain disease and its symptomology. Eventually, if the symptoms are diagnosed, the diagnosis can be limited by what's known symptomology, the diagnostic tests used to assess and confirm those symptoms, whether the patient has access to adequate medical care, and also whether they have access to physicians and physician subspecialties. In the case of rare diseases, it can take up to 7 years for a patient to get a correct diagnosis. And I'll give you an example of a rare disease and all the patient touch points that they have to go through. Then the patient has a discussion with their physician to discuss their symptoms and treatment selections. The caregivers are also highly engaged. The physician and the patient go through a set of treatments. Their prescription choices can be constrained by financial considerations, which the patients cannot afford the medications or are not fully covered by insurance. Once they're on treatment, they can get patient support, which is instructed on how to take the medication and how to provide support for their caregivers. And then finally, the treatment fulfillment. They can continue on a treatment unless they need a therapy change. And changes in therapy can occur when symptoms do not improve or worsen over time. So let's address a disease called nephrotic syndrome as an example. Here's a disease overview and classification. So nephrotic syndrome can be split into primary and secondary nephrotic syndrome. Within primary, there's minimal change disease, focal segmental glomerulosclerosis, or FSGS, membranous nephropathy, or MN. In secondary nephrotic syndrome, they're secondary to systemic disorders and congenital nephropathy.